Hi, everyone. I'm Kelly O'Horo, and this is Adaptable Behavior Explained. Hi, friends. Today we're talking about something that confuses a lot of people, and honestly, it confuses a lot of therapists too, and that's the difference between panic and health anxiety. Have you ever thought to yourself, what if this is a heart attack, or what's wrong with me, or what if doctors missed something, or what if this sensation means something that's seriously wrong? And also experience sudden waves of intense, like physical distress that feel unbearable, you might have wondered which one you're dealing with. Well, panic and health anxiety often overlap, but they're not the same process in the nervous system. And knowing the difference matters, not just for your understanding, but for healing. So today we're going to talk about why panic and health anxiety get confused, and primarily how the fear system and the panic or grief system play different roles, what health anxiety actually is, and how to tell which loop you're in. And we know we've got this noisy part in our brain that will spin on repeat when we're obsessing about something that could potentially be wrong with us, and we're afraid and we don't know what that is. And some of us might even jump into WebMDing ourselves, which is never a healthy loop to get into. And we're also going to talk about how treatment approaches differ. Of course, because I'm an EMDR therapist and this is how I treat patients, how this can really help these symptoms. So let's talk about first why panic and health anxiety get confused. Panic and health anxiety look similar on the surface because they do share physical sensations. Both of them can involve that racing heart, chest tightness, sometimes dizziness, sometimes shortness of breath, maybe GI distress, like we have gas or gastrointestinal issues, a sense of alarm or vigilance. But what the body is responding to is different in each case. Panic is often sudden, intense, and it's body driven, whereas health anxiety is often persistent, cognitive, and vigilance driven. This is like in our mind as opposed to physicality. One is about loss, and the other is about prediction of threat. The body may feel the same, but the nervous system question is really different, and this is how you can kind of tell the difference for yourself. As we talked about in the previous episode about panic comes from what Jaak Panksepp calls the panic and grief system, and most people don't know that. Most people think that panic is about fear, but the system activates in us this loss, separation, attachment rupture, or threats to our safety through disconnection. So when this system fires, the body isn't asking, am I about to die? It's asking, am I alone? Am I unsafe? Or am I without support? Or am I going to lose that support? And that's why panic attacks can feel catastrophic even when there's no danger. There's ancient mammalian alarms that are meant to prevent loss of connection because, let's face it, we can't live well alone if we're young. We need others to survive, and we depend on that for our very survival. So panic is the body responding to loss, not the mind misinterpreting danger. Now, health anxiety lives in the fear system. Health anxiety is often called illness anxiety, is different. Health anxiety activates that fear system, which is about anticipating danger. The core fear is, what if my body is failing and I don't catch it in time? What if this ailment actually means something more terminal, like cancer? Health anxiety is driven by hyper-monitoring the body. It's interpreting neutral sensations as potentially dangerous or problematic, and it kind of also has in the background reassurance seeking or avoidance of doctors or over-reliance on doctors. This is like Googling symptoms and MedMDing and co-piloting or chat GPTing, whatever your current issues are, and then like finding facts to justify the way that you feel. There's also a tremendous difficulty tolerating the uncertainty of it. And this is because the nervous system here is scanning for future threat. It's not responding to attachment loss. Health anxiety asks, what if something's wrong? And panic asks, what if I'm not safe or I'm supported or if I'm alone? So the bad news is they feed each other. Panic and health anxiety totally feed each other. And this is where things get tricky and why so many people get stuck with this. A panic attack can trigger health anxiety. That sensation was terrifying. What caused it? What's wrong with me? And health anxiety can trigger panic. What if this sensation means something serious? And it creates this loop. The body loop, the body sensations, the panic response, fear interpretation, increased vigilance, and then another panic response in response to the constant spinning. And at this point, fear is maintaining panic, but fear didn't necessarily start the panic in the first place. So health anxiety can keep panic alive and like thriving, even when panic began because of grief. And so this can spin. And for people whose loss started because of illness, those things get really tightened. So let's say you lost a partner, a parent to an illness prematurely. Now you're kind of dress rehearsing the tragedy that what if this happens again to someone else that I love or to myself? And so it's hard to tell which one you're dealing with when this is happening. You know, I've had clients that have had these propensities because of their own loss, and they do end up really myopically focused on health consequences because they don't want to miss something in the future. And if you think about it, we're thinking about what we might miss because it gives us an illusion of control. If we become overly aware and responsible about something, proactively addressing our health, then maybe we will catch something in time and it won't end in the same negative fate that perhaps what we experienced before did. So if this is something that happens to you, here's some orienting questions that you can ask yourself if you're running into this. Because panic tends to sound like something terrible just happened. I can't handle this. I'm not okay right now. I need to stop this immediately. I've got to bolt. I've got to get away. Whereas health anxiety tends to sound more like, what if this is something serious? What if this gets worse? What if no one catches it in time? I need certainty before I can relax. And both are valid and both are treatable, but they require sort of different entry points for healing in order to address this cause and effect scenario. And this distinction matters because we need to know, one, as the client, you need to know like your history and what probably predicted or predicated your kind of presenting issues so that you can better explain to your therapist, if you're going to get treatment for this, what's going on and why you sort of see this as having happened to you. And then also as therapists, if you're listening, you need to understand the difference in the cause and effect loop and how these cycles do really predict and also feed off of one another. So when panic is primary, treatment often focuses on the nervous system regulation, processing loss or grief or attachment trauma. Reprocessing early panic experiences can be really helpful. And EMDR therapy is especially effective here because we can really resolve the maladaptively encoded memories and really fully grieve the experience that happened that maybe wasn't able to happen at the time because of shock or survival. Whereas when health anxiety is primary, the treatment often includes like tolerating uncertainty. It's sitting with yourself in the unknown, reducing your need for reassurance and reassurance seeking and just being with yourself in that moment. It can have, more cognitive and behavioral strategies as part of the treatment because exposure to uncertainty rather than bodily threat is part of it. And then when both are present, which is really unfortunately very common, treatment must address both loops, not just the symptoms. You can't think your way out of grief and you can't reprocess uncertainty without first addressing the fear. And so what I love is that EMDR is a really beautiful fit for these presenting issues because it's particularly helpful when panic attacks trace back to earlier losses. I always teach my therapists, when you have a client that presents with panic, ask them when they first had their panic attack. What was happening in their life at the time of the first event? Usually there was some kind of loss, whether it was parents divorcing or a loss of a family member or something going on that really was, that might have upside down their life. Body sensations are tied to helplessness or abandonment or that grief. And early panic experiences created lasting fear networks, basically that the other shoe is going to drop and I've got to be always on alert that it's going to happen to me again. Someone logically knows that they're safe. They can look around their life and they can say, I know that this isn't now and this isn't my life, but their body just will not buy it. It won't agree. So EMDR helps the nervous system to update that old information so that the body no longer needs to sound this alarm that threat is now. PTS symptoms and all of these trauma response symptoms are really a time orientation issue. The body thinks that now is then. And when we're triggered in the sensory stimulus or the environment now, we're alerted to past unresolved memories that are not fully encoded accurately. And so it doesn't eliminate the uncertainty. It just helps to resolve what's already been carried for way too long. So if you've been struggling to figure out whether you're dealing with panic, health anxiety, or both, I hope that this brings you some clarity rather than confusion. I hope that it validates your experience a little bit and that you realize you're not alone. This is common. And your symptoms make sense, especially if you're someone who realizes that your threat perception got a little bit wonky during the time of trauma in your life. Your nervous system is not broken, and there's nothing that's wrong with wanting relief from these symptoms. It's just important that you understand which system is activated, because it helps us respond with compassion instead of fear, and that's both for yourself and to others. And it also helps us triage as therapists kind of what angle we need to look at this and in what way we need to treat this. So if this resonates for you, please consider reaching out to an EMDR trauma therapist who understands panic and health anxiety and trauma through that nervous system lens, especially a well-trained EMDR clinician, because when panic is rooted in loss or attachment wounds, then this is really the best way to approach. Thank you so much for listening to Adaptable. If you found this episode helpful, please make sure to subscribe or share it. If you are a watcher of our show and you haven't yet subscribed, please do so. And until next time, don't forget to lead with love. It'll never steer you wrong.